I'm Dr. Anojan Kadarkamanai again. I'm a family doctor here, and I work at the COVID assessment centers here in Durham region and at the COVID vaccine clinics as well. Luckily for us here in the Durham region, we've been able to kind of roll out the vaccines through Lake Ridge Health and been able to vaccinate the priority populations. And so as a physician there, kind of, we administer vaccines, counsel patients based on the risks of the vaccines and the benefits, and kind of on an individual basis, and also monitor and manage any adverse events when they rarely occur while we do this. So we use TraceScan amongst all the employees here. And essentially it's just a wearable device, and most of the employees here, they feel comfortable using it while we're at our place of work, because it doesn't locate, it doesn't track our location and things like that. So it's just using Bluetooth, and then we wear it every single day that we work in the office. And then if one of us to come positive, then we let the administrator know, and then that person's able to kind of go back and see who we've come into contact with using the app's settings. Any manufacturing, even construction, where you're going to, sometimes you cannot distance more than 6 feet when you're doing your job in an appropriate manner. So in those type of industries, large manufacturing, even down to airports, all of those scenarios would require that contact tracing and using wearable technology, where all of that stuff can be automatically configured is important. Again, it's been very challenging because we're used to seeing our patients and delivering care that way. I think now even especially if we're seeing patients who have potential risks and stuff like that, we might even decrease the frequency of how often we see them, just to reduce their risk, right? Even though they are the patients that need the care the most. This is very challenging. It's been going on longer than I think almost what many people predicted initially, and with variants of the virus and possible further shutdowns and changes in zones and all these confusing things out there. Sometimes just going outside and getting some fresh air and exercising or walking, I think those are very important things to kind of not only for your health, physical health, but for your mental health as well. It's very tough, one good thing that is hopefully going to happen soon is once the weather gets better, I think the most important thing that anyone can do is just get outside and walk and do things that are going to kind of relieve yourselves and kind of give you some sense of normalcy.